Hello students, welcome to this session of DMLT practicals. Let's study hematology practicals.
So here you can see the Siley apparatus which consists of hemoglobin pipette, hemoglobin tube and comparator. So first thing required in hematology laboratory is hemoglobinometer. So hemoglobinometer is also called as Siley's apparatus. It consists of hemoglobin pipette, hemoglobin tube and comparator to compare the readings with the standard glass. And the uses of the hemoglobinometer is hemoglobin estimation, and depending on that we can divide the anemia whether it is mild, moderate or severe. Second thing required for the hematology laboratory is RBC pipette. So this pipette has a large bulb which contains red glass bead, so that we can differentiate it from the WBC pipette which contains white glass bead. It has three markings: 0.5, 1 and 101. So blood we have to take up to 0.5 marking, and then diluting fluid up to 101 marking, so that the dilution of blood with the diluting fluid is 1:200 for doing RBC count. So uses of RBC pipette is one, RBC count estimation, and second, platelet count estimation. Third thing is WBC pipette. It is smaller than red seed pipette, and its bulb is also smaller, which contains white bead. It has three markings: 0.5, 1 and 11. So blood we have to take up to 0.5 marking, and WBC diluting fluid up to 11 marking, so that dilution is 1:20. So uses of the WBC pipette are to count total WBC in blood, to count total WBC in all body fluids like CSF, peritoneal fluid, pleural fluid, pericardial fluid, synovial fluid, and also total sperm count in semen. Fourth thing is newborn's chamber. It is also called as counting chamber. So it has area of 9 millimeter and depth of 0.1 millimeter. It has two stages separated by a gutter, that is a space. So 9 square millimeter area of counting chamber is divided into 9 squares, that is 1 square is 1 square millimeter equally. The four corner squares measure 1 square millimeter and divided into 16 small squares and are used for counting WBCs. Central square is divided into 25 squares, and each one is again divided into 16 small squares, so that the central square is used for the counting of the red cells and platelets. The uses of the newborn's chamber: to count WBC count, RBC count, platelet count, sperm count, and total cells in CSF, pleural fluid, ascitic fluid, synovial fluid, pericardial fluid. Fifth thing is Westergreen's tube. It is also called as ESR tube. It is 300 millimeter long, and graduations are 0 to 200 markings. And the uses is determination of the ESR, that is erythrocyte sedimentation rate. Sixth is the Ventrobes or hematocrit tube, also called as PCV tube. It is 110 millimeter long, and it has 3 millimeter internal diameter, and the markings are 0 to 10 and 10 to 0. So uses are the scale 0 to 10 used for ESR, and the scale 10 to 0 used for PCV, that is packed cell volume. So procedure: so you have to take 0.1 N HCl in the tube up to 20 mark, and then blood 0.5 ml, or it is 0.5 marking, or 20 microliter in HB pipette. Then mix that blood in the hydrochloric acid. Before that you have to wipe out the extra portion of the blood, then put in the hydrochloric acid, wait for 10 minutes after mixing, and then dilute with distilled water, and then compare against the glasses present in yellow glasses or brown glasses present in comparator, and then you can match the hemoglobin and see the level. So in that, first is a principle. So when blood is mixed with Rapkin reagent, so reagent contains potassium ferricyanide and potassium cyanide. So hemoglobin combines with that and forms cyanamide hemoglobin, that is brown in color, and then OD is taken against the hemoglobin standard, that is 15 gram percent in 540 or green filter. Sample is capillary blood or anticoagulated, that is EDTA blood. Procedure: so you have to take 3 test tubes: blank, test and standard. Take 5 ml of Rapkin reagent in each test tube. add 20 microliter of blood from the HB tube, HB pipette to the test tube. Then in the 20 microliter hemoglobin standard of 15 gram percent to the standard test tube. Then mix and wait for 5 to 10 minutes, and then take the optical density against the green filter, and then do the calculation procedure. So you have to take zero point 0.5 mark in the RBC pipette blood, and then dilute it with RBC diluting fluid up to 101 mark, then mix and then discard few drops, and then load the chamber, wait for few minutes, and then see the RBCs. So in that the central square is RBC counting chair, and in that you have to count total number of RBCs, and the calculation is total RBC count is equal to n into 10,000. So procedure in short: take zero point 0.5 mark, take blood up to 0.5 mark in WBC pipette, then dilute it with WBC diluting fluid up to 11 mark, mix, wait for a few minutes, then load the chamber and count the WBCs in four corner of the WBC area, that is four corner of the newborn's chamber, and then do the calculation by formula. Total WBC count is equal to n into 15. So in the procedure short, you have to take dry clean glass slide, then take one drop of blood at the end of the slide, and then with the help of another spreader slide you have to spread that drop forward in shape of tongue, and then you can stain it, fix and stain it. Procedure in short: up to 0 0.5 mark in RBC pipette you have to take blood, and then up to 101 mark you have to take platelet diluting fluid, then mix, discard few drops, then load the chamber and count the platelets. So counting of that platelets is done in the central RBC counting or platelet counting square. In that corner 4 squares and central 1 square is counted, or total you can count all the squares, and then formula is total platelet count is equal to n into 2000.
Determination of absolute eosinophil count. So in that you have to take 0.36 ml, that is 360 microliter of eosinophil diluting fluid in the test tube, and 0.04, that is 0.40 microliter of the blood, that is twice of the HB pipette. Keep it for 10 minutes and then load the chamber, and then see in the eosinophils in all the squares, 9 squares, and the formula is the total number of eosinophils is equal to number of cells counted into 10 divided by 0.9. So the factor comes 10. So the normal value is 40 to 440 cells per cubic millimeter, and it is increasing mostly parasitic and allergic infection.
So procedure is by two methods: Westergreen method or Winthrop method. So long tube is called as which has marking 0 to 200. It is called as Westergreen tube, and Winthrop tube is of 0 to 10 marking. So fill the Westergreen or Winthrop tube and then keep it in stand and then wait for 1 hour and then take the reading. So that is the procedure. So we'll see procedure of PCV by Winthrop method. So fill the Winthrop tube with blood with help of Pasteur pipette, then keep it in centrifuge. Take another Winthrop tube filled with water and put it in the centrifuge opposite to the to the previous tube for the balance, and then centrifuge it for 30 minutes, and then take the reading of red cell column from the bottom of the tube. So procedure in short, in this diagram you can see, so give a prick 1 to 2 millimeter deep over the finger after cleaning it with spirit swab, and then blot the blotting paper with drops every 30 seconds, and then after that when the bleeding is stopped you note the time. So when you give prick, that time you have to start the stopwatch. So in this diagram you can see this procedure. So clean the finger with spirit swab, then prick it with lancet or needle 1 to 2 millimeter deep, let the blood flow clearly, and then take that blood inside the capillary, and then wait for few minutes, and then after that at regular intervals like 30 seconds you have to break the capillary, and then note the fibrin string formation at the end of between two ends of the capillary. And if it is noted that fibrin string between two capillary ends, then stop the stopwatch and then note the time. So now in short, principle of blood grouping is when antigen and antisera they are mixed together, they forms agglutination or clumps, and then we can decide the blood group. So in short forward method, it can be done on slide or tube method. So you have to take one drop of blood and then one drop of known antisera, that is anti A, anti B, and add these two, wait for 2 minutes and see for the clumps. Now little bit about RH antigen. So RH antigen, it is discovered in rhesus monkey, and when one drop of blood is taken, one drop of anti-D from the kit and see for the clumps. So if you see clumps, it is RH positive. If you see no clumps, it is RH negative. And natural RH antibodies are not present. They are immune antibodies. When the RH negative person gets exposed to RH positive blood, then there is formation of antibodies, and then that is called as RH antibodies. So it can be seen in mismatched blood transfusion or hemolytic disease of newborn.
Let's study clinical pathology practicals. Physical examination of urine. So points are color, volume, appearance, odor, pH, and specific gravity.
Now we will see examination of urine. So it is divided into three parts: physical, chemical, and microscopic. So in physical examination, it is a gross examination. So by observation you have to see what is the volume, color, appearance. Then chemical examination. So chemical examination is by doing chemical test on the urine by using reagents, and then you have to see the color differences, and then you have to find out whether it is positive or negative. And microscopic examination by doing centrifugation of the urine sample, then take that deposit one drop on a slide, put cover slip, and then see under microscope, or you can stain the smear and then you can see the elements of the urine. So that is microscopic examination. So first we will see physical examination of urine. So in that, first is a volume. So normal volume of urine in 24 hours, it is 750 to 1500 ml. So if it is more than 1500 ml in 24 hours, it is called polyuria, and it is seen in diabetes mellitus, diabetes insipidus. Then less than 400 ml urine sample is seen in oligouria, in kidney disorders, and then less than 100 ml urine is called anuria. So anuria means almost absent urine, less than 100 ml in 24 hours, and it is seen in renal failure or renal conditions like glomerulonephritis, chronic glomerulonephritis. Some non-renal conditions are there in which you can see anuria, that is less urine production. So it is mismatched blood transfusion reaction or blood transfusion reaction or obstruction in by urinary passages by stone. Now second point is color. So normal urine is pale yellow in color because of the urochrome or urobilinogen formation. Dark yellow, it is abnormal, it is seen in jaundice or patient taking vitamin B12 vitamin B complex medicines. Red or brown, it is seen because of the blood or hemoglobin, or patient is taken beet, so the color changes. Appearance, it is normally clear, but if it is cloudy, it may be because of the proteins, and turbid may be because of the RBC, WBCs or bacteria increase in the urine. Then odor, it is normally aromatic, and fruity odor can be seen in diabetic ketoacidosis. So this diabetic ketoacidosis is a complication of the diabetes. In that, ketones present and odor is fruity. pH, normal urine pH is acidic, and then abnormal, it is alkaline, maybe in infection or triple phosphate crystals. Then specific gravity, normally it is 1.003 to 1.035. It is determined by the urinometer, and that urinometer is calculated at 20 degrees Celsius, therefore correction factor required. So temperature correction factor, so you have to add 0.001 every 3 degree of the centigrade. Hyperstainuria, when the specific gravity is more than the 1.040. So it is mainly seen in diabetes mellitus or nephrotic syndrome because of the sugar and proteins respectively increase in the urine. Hypostainuria, when the specific gravity is low, less than 1.010, and it is seen in diabetes insipidus, because in insipidus the urine volume is increased but either sugar or proteins are not there, so because of that the specific gravity is decreased. So this is a differentiating point. Specific gravity is differentiating point for the diabetes mellitus and diabetes insipidus, because in both conditions you will see polyuria. Then isosthenuria when the specific gravity is fixed. So this is about physical examination of urine.
In chemical examination of urine, so the tests done are sugar, then protein, bile salt, bile pigment, ketone, and the occult blood.
Now we will see chemical examination of urine. So first is protein. So the method is heat coagulation and acetic acid. And procedure, you have to take two-thirds of the test tube in that urine and then heat the upper portion, and then if you see white precipitate, then add acetic acid and then see the precipitate. If precipitate dissolves, then that means proteins absent, and if the precipitate persist or increase in white precipitate, then it is proteins present. The principle is the proteins precipitate when they are boiled in acid solution or by heat. The significance, that is urine containing protein, is called as proteinuria, and they are seen in pre-renal conditions like fever, exercise, shock. Then renal condition like glomerulonephritis, nephrotic syndrome, pyelonephritis, nephrosclerosis, and post-renal like pyelitis, urethritis, cystitis, urethritis. So in this diagram you can see this procedure hitting the upper portion of the tube containing two-thirds of the urine. So this is heat coagulation method for the detecting proteins. Now second test in chemical examination of urine is urine sugar by Benedict's test. So in that procedure is you have to take test tube and then take 5 ml Benedict's reagent, that is blue in color, then add 8 drops of urine and then you have to heat it till it gets boiled and then see for the color changes. So in color changes, the negative is blue color, then greenish blue is trace, greenish yellow is 1 plus, yellow is 2 plus, orange is 3 plus, and red or brick red is 4 plus. So this is the semi-quantitative result of the urine sugar test. The principle is cupric ions present in Benedict's reagent, they are reduced to cuprous oxide by sugar and other reducing substances like glucose, lactose, fructose, and then the color changes according to the concentration of the reducing substances. The glucose present in urine is called as glucosuria, and it is seen in mainly diabetes mellitus or the over intake of the carbohydrates or sugars. Now we will see urine ketone test done by Rothra's test. So in that you have to take 5 ml of urine in test tube, then saturate with ammonium sulfate powder. So saturate means you have to go on adding ammonium sulfate powder till you will get that it is not dissolving and the ammonium sulfate powder is remained in the test tube. Then add few drops of sodium nitroprusside from the side of the test tube and then liquor ammonia from the side of the test tube, and then see for the ring formation at the junction of these two liquids. So if it is purple, it is positive test, it remain colorless, it is negative. So principle is these ketone bodies, that is acetone, acetoacetic acid, butyric acids. So these ketone bodies react with the ammonium sulfate powder and nitroprusside and liquor ammonia and forms purple ring at the junction. The conditions seen in this ketonuria, that is ketones present in urine, are mainly diabetic ketoacidosis, and sometimes you can see in fasting state dehydration, fever, exercise, vomiting, loose motions. So that is dehydration conditions. Now we will see bile salts by Hayes test. So here you have to take 3 to 4 ml of urine in a test tube and then sprinkle bile sulfate powder, that is sulfur powder, on the surface of the urine, and if it is floating on the surface, the test is negative, and if the sulfur particles sink at the bottom, the test is positive. So these bile salts present in urine, they lower the surface tension of the urine and therefore the sulfur particles sink to the bottom. So conditions when the bile salts are present in urine, they are mainly in jaundice, so either hepatic or obstructive jaundice, but it is negative in hemolytic jaundice. Then we will see bile pigment by Faucett test. So here you have to take 3 ml of urine in test tube, 3 ml of barium chloride, mix and then centrifuge. So that precipitate is filtered, and then to the precipitate you have to add Faucett's reagent. No color change is negative and green color change is positive. So mainly the principle is biles, barium sulfate plus barium chloride, they form barium sulfate, and then the bile pigments form green color after addition of the Faucett reagent. So clinical significance of this test, so bile pigment present in urine, seen in hepatic and obstructive jaundice and not seen in hemolytic jaundice. Now urobilinogen. So here you have to take that 3 ml urine and 3 ml barium chloride. So that precipitate you have to add Faucett reagent, and to the liquid portion, that is filtrate, you have to add Ehrlich's reagent to the supertant, and then see for the color change. If light pink, it is normal, and dark pink or cherry red color, it is seen in urobilinogen increased condition, and that is seen in mainly hemolytic jaundice or wherever hemolysis because of the mismatched blood transfusion or hemolysis because of the parasites like Plasmodium falciparum, dengue. So you can see the urobilinogen present, that is dark red in color. Occult blood test. So occult means hidden. So the blood which is not seen by eyes is called occult blood, and it is mainly done by taking that benzene reagent in a equal quantity of glacial acetic acid and hydrogen peroxide, and then add this to the urine on a filter paper, and then see for the color change. If it becomes blue within few seconds, occult blood test is positive, and no color change, occult blood test is negative. So the principle is this hemoglobin acts as a peroxidase. So it breaks down hydrogen peroxide into H2O plus O, that is nascent oxygen, and that nascent oxygen combines with benzene powder and glacial acetic acid and forms blue color. So conditions seen in hematuria, that is blood present in urine, and it is seen in mainly hemolysis or bleeding in a urinary tract.
Microscopic examination of urine. So the procedure, take urine in the centrifuge tube, then you have to centrifuge by taking opposite side balance, and then for 5 to 10 minutes 2500 rpm speed you have to centrifuge, then discard the upper portion and take deposit on this cover slide, put cover slip and see under low power, and then confirm under high power. So the things seen are cells like RBC, WBC, cells, bacilli, cast like granular hyaline RBC, WBC cast, and crystals like calcium oxalate, triple phosphate uric acid, and other crystals.
Now let's see microscopic examination of the urine. So as before I told you the procedure, you have to take urine in a centrifuge tube, then centrifuge it at the speed of 2500 to 3000 for 15 to 20 minutes. Then all the sediments will go at the bottom, so that deposit you have to take 1 drop on slide, put cover slip and see under first low power and then confirm the things on high power. So the mainly seen elements in microscopic examination are cells, cast and crystals and parasites. So now we will see cells. So there are RBC, pus cells means WBC, epithelial cells, yeast cells and bacteria. So mainly RBCs are seen in hematuria, pus cells are seen in urinary tract infection, then yeast cells are seen in fungal infection and bacteria in urinary tract infection. And these are the crystals present in acid urine and alkaline urine. So in acid urine they are mainly calcium oxalate, so they are dumbbell shaped or star shaped. Then uric acid, they are diamond rhomboid shape or rosette form. Then cholesterol crystals. In alkaline urine they are triple phosphate, so like envelope shape, and they are seen in calculus or chronic cystitis. So parasites are mainly seen in urine are Trichomonas vaginalis. So they are mainly tropozoites giving motility, and then Enterobius vermicularis, this ova you can see in urine. Then here you can see the definition of cast is urinary cast are formed in lumen of tubules of kidney, and they are because they are aggregated because of the mucoprotein that is called tam horsefall protein. Now next is the cast. So the cast, they are because of the degeneration of the cells or aggregation of the proteins, that is tam horsefall mucoproteins. So the tubular structure formed in urine, they are called as cast. So this tubular shape of the cells or material is because of the tubular the shape of the tubules, that is loop of Henle or proximal convoluted tubule. So these are of different types, like granular cast, they are mainly seen in renal diseases like UTI, nephrotic syndrome. Hyaline cast, then waxy cast, red cell cast, they are seen in glomerulonephritis or hemolytic condition, bleeding disorders. White cell cast, they are seen in urinary tract infection, nephrotic syndrome. Fatty cast, they are seen in nephrotic syndrome. So these are different casts.
Physical examination of stools. So points are color, consistency, mucus, blood, and volume. So color, it is normally brown, and if it is abnormally red, maybe because of bleeding. Melena, because of the bleeding in upper GI tract. Clay color or fatty color, it is obstructive jaundice or steatorrhea, that is malabsorption. Consistency, normally solid, and if it is abnormally liquid, it is seen in diarrhea, cholera, dysentery, rice water in the cholera, and hard consistency in the constipation. Mucus, normally mucus blood absent, and if it is present, they are mostly seen in dysentery. Volume is small, and if it is increased profuse, then it is diarrhea or indigestion. Chemical examination of stools. pH is normally acidic, abnormally alkaline, seen in the dysentery or the infection of the GI tract. Focal blood normally absent. If it is present, seen in dysentery or bleeding. Reducing substance normally absent. Abnormally, it is present, so it is seen in children's, that is small children's lactose intolerance.
Hello students, now we will see chemical examination of stool. So first test is occult blood. So occult means the blood which is not seen by eyes, that is hidden blood, is called occult blood, and then that we can confirm by benzidine test. So in that you have to take benzidine reagent and then add glacial acetic acid, hydrogen peroxide, then add stool sample and see blue color immediately. If it is there, then it is positive, and that is occult blood seen in bleeding ulcerative conditions. In this picture you can see this filter paper with blue color, so that is positive occult blood test. Second test is pH, so that is done by pH paper. Normally stool is acidic, and if alkaline, then that means bacillary infection is there. Third test is reducing substance, that is done by Benedict's test as we do for the urine, and it is seen for the lactose intolerance in a newborn babies. So same, you have to take Benedict's reagent, add stool sample, mix and boil and see for color changes. And if color changes from green, yellow, red, then it is positive test. It is positive in lactose intolerance in the babies. Thank you. Hello students, now we will see microscopic examination of stool samples. So that we do by saline method and iodine method. So in saline method you have to take 1 drop of saline, add some stool sample, mix and put cover slip and see under microscope, that is saline wet mount. In iodine you have to take 1 drop of Lugol's iodine, then add stool sample, mix and see under microscope. So this in saline preparation we can see motility of the tropozoites, and in iodine preparation we can see all cyst form. Hello students, now we will see physical examination of semen. So after collection of semen, wait for half an hour and then take the readings. Like color, normally it is greyish white. Volume, it is around 3 to 5 ml. Viscosity, that you have to do by taking semen sample after half an hour, that is after liquefaction time, into the pasture pipette and allow it to go drop by drop. If it is going drop by drop, then it is normal viscosity. If it is not going drop by drop, it will form a line of string from the pasture pipette, then it is increased viscosity, and increased viscosity may be the reason for infertility. Liquefaction time means after collection of sample, it is usually coagulum, and then after 30 minutes, that is half an hour, it liquefies, that is called as liquefaction time. Thank you. Students, we will see chemical examination of semen. So in that two tests are done, that is first is pH, that is done by pH paper, and normal pH of the semen is alkaline. Second test is fructose, so it is done by taking resorcinol reagent in test tube and then add semen and boil it like Benedict's test and then wait for 5 minutes. So if red precipitate forms, that is it is fructose present, and if no change in color, that is light red color, it is fructose absent, and usually it is seen in infertility. Thank you. Hello students, now we will see microscopic examination of semen. So in that first is the motility of the sperms. So for that you have to take one drop of sample after liquefaction on the slide, put cover slip and then see the motility. And average you have to count 200 sperms and then observe the motility in percentage. The report is given as actively motile, the sperms which moves very fast, sluggishly motile, the sperms which moves the side by side only, and non-motile means non-moving sperms. So normally more than 60% sperms are actively motile. Second test is determination of sperm count. So this we have to do the dilution in WBC pipette of 0.5 mark semen sample and 11 mark semen diluting fluid as we do in WBC count. Then wait for 5 minutes, then mix the contents, discard few drops, then load the chamber and count sperms in 4 corner squares, that is WBC squares, and then you have to count the formula like number of sperms is equal to 50,000 n into 50,000, and then normal range is 40 to 300 million sperms per ml. Azoospermia when no sperms are seen, oligospermia when less than 40 million sperms are seen in a count. So it is significance for the infertility. Then third is morphology of sperms. So you have to make a smear like we do in WBC DLC blood smear, and then stain it by Leishman method and see the morphology. So in this slide you can see normal morphology, that is head, middle piece and tail. So the abnormal morphology you can find head defects, double head, small head, big head, or middle piece defect, that is no middle piece or double middle piece, or tail defects like rudimentary tail, long tail, curly tail, or no tail. So these are the abnormal forms of sperms, and if they are more than 15%, then it is may be causing infertility. Thank you.
Let's study microbiology practicals.
Hello students, today we will see basic requirements in microbiology laboratory. So there are some glasswares required like petri dishes for culture media, cavity slides for motility testing, tuberculin syringe for Montauk's test, wire loops for inoculation of sample, microscopic slides and cover slips for smear making and staining like gram stain, Zn stain, spirit lamp or Bunsen burner for heating, sterile swabs for specimen collection, or inoculation of sample for antibiotic sensitivity testing. Instruments like microscope for microscopy of stain smears like wet mount preparation, or stain smears like gram stain, Zn stain. Autoclave sterilization of glasswares for culture media. Then hot air oven sterilization of glasswares, incubator for growth of microorganisms and antibiotic sensitivity testing. And culture media routinely blood agar, nutrient agar, Mekong agar, etc. are required. So this is basic requirements in microbiology laboratory. Thank you.
Microscopy, compound microscope principle. A microscope is used to produce an enlarged and well-defined image of objects too small to be seen with naked eyes. The degree of enlargement is called magnification or magnifying power of the microscope. Parts are mechanical parts: base, stand, handle, and stage. Magnifying parts: optical lens system, objectives 4x, 10x, 40x, 100x, and eyepieces. The 10x is low power, 40x is high power, 100x is oil immersion lens, and 4x is the scanner. Illuminating parts: condenser, iris, diaphragm, and mirror. The uses of parts: base gives stability to microscope, stage to keep slide on it, objectives for magnification of object, eyepiece to see magnifying image, condenser to pass light from lamp, iris, diaphragm to reduce or increase the amount of light by reducing or increasing the opening, mirror to pass sunlight on object. Types of microscope: simple microscope to see insects, compound microscope to see bacteria, fungi, parasites, electron microscope to see viruses, phase contrast microscope, examination of living material like spirochetes, motility. Diagram microscope, condenser is the important part to see spirochetes. Fluorescent microscope, diagnosis of tuberculosis by staining with the fluorescent lights. Hello students, let's study moist heat. So in that we will see autoclave in detail. So it also called as steam sterilizer. The principle, when water is heated in closed container, it produces vapor and then it causes vapor pressure. Then when water boils in closed container, the vapor pressure is increased more than the atmospheric pressure, and then it has a more penetrating power to kill the organisms. And the mechanism, killing of organisms by irreversible coagulation, denaturation of enzymes and proteins. The types of autoclave are horizontal when it is in large volume, and it is mainly used in CSSD department. And the vertical one is in small volume, used in most laboratories. The components, there are three main components: pressure chamber, lid and electrical heater. So pressure chamber is consists of the large cylinder, either vertical or horizontal. It is made up of metal or stainless steel, and it has a steam jacket, that is water compartment at the bottom. The lid, it has discharge tap for passage of air and steam, pressure gauge for the pressure measurement, and safety valve to remove the excess steam. An electrical heater, it is attached to the jacket that heats the water to produce steam. The working procedure: the materials to be sterilized are placed inside the cylinder. A steam jacket is filled with sufficient water, and then lid is closed with the help of clamps, and the electrical heater is put on. Now there are three phases. So first is conditioning phase, second is exposure phase, and third is the exhaust phase. So in conditioning phase, you have to give condition of temperature, pressure and time. That is temperature 121 degree Celsius, pressure 15 lbs and time 15 minutes. So after the water boils, the air in the chamber is completely displaced by the steam. So the steam pressure rises and then it reaches to the desired level, that is 15 lbs pressure. Then the safety valve opens and excess steam is removed out. Exposure phase, the holding period is for 15 minutes. Exhaust phase, so after the holding period is over, the electrical heater is switched off and the steam sterilizer is allowed to cool till it reaches the atmospheric pressure, and then the material inside is removed. The care and maintenance of the autoclave. So we have to always put water in steam jacket. Do not forget to put off gas burner after the holding period is over. Never leave autoclave unattended when pressure is rising, and never open the lid immediately after heating period is over. So we have to allow it to cool and then open the lid. Sterilization control: physical conditions like temperature, time and pressure. Chemical indicators like external pack control, that is autoclave type, or Browey test or internal pack. The biological indicator: spores of Geobacillus steothermophilus are the best indicator, which kill spores, in which the spores are killed in 12 minutes at 21 degrees Celsius. Uses of autoclave. So there are mainly two uses: hospital uses and the laboratory uses. In hospital uses, the sterilization of surgical instruments, anesthetic equipments, dental instruments, implanted medical devices, surgical drapes and linen, biomedical waste treatment for disposal. Laboratory uses: sterilization of glassware, test tubes, slides, pipettes, petri dishes used in the laboratory, sterilization of culture media for preparation, inoculated infected culture plates, killing of microorganisms and the spores. Disinfection, so it is chemical disinfection method of sterilization. So many chemicals act as disinfectants. The mode of action is protein coagulation and disruption of the cell. So the glutaraldehyde, mainly 2% used in the sterilization of endoscope, cystoscope, laryngoscopes. Povidone iodine, it is halogen group for the preoperative antiseptic and wound cleaning. Dettol, antiseptic for wound cleaning. Hypochlorite, 1% hand washing, 4% floor disinfectant, and cleaning of infected glassware of the instruments village, uh, mainly for the HIV. Hydrogen peroxide, oxidizing agent, disinfection of wound and environmental surfaces, ventilator and soft contact lenses. Formalin aldehyde group, 10%, preservation of anatomical specimens and the stool specimen. Phenol, 5%, disinfection of environmental surfaces and disinfection of the sputum. Preparation of smear. So you have to take the clean slide and then sample, then spread that sample over the slide with help of cotton swab or the another slide, and then you have to dry that slide in the air and then fix that slide with the help of heat, and then smear is ready for the staining. Monochrome staining on the smear. So it is simple staining. So you can take either crystal violet or any stain like methylene blue. So you have to make the smear, heat fix that smear, and then flood that smear with the crystal violet, and then after 1 to 2 minutes wash and air dry, and then see under oil immersion lens by putting oil on the smear. So all bacteria will appear as violet in color.
So students, use of gram staining is for the differentiating bacteria into two large groups, that is gram positive and gram negative. And if they are round 1 micron in size, they are cocci, and if they are 2 to 10 micron size, that is rod shape, they are bacilli. So total 4 types of bacteria are there: gram positive cocci, gram positive bacilli, gram negative cocci, gram negative bacilli. The principle of this gram staining is based on total three theories. So first is pH theory. So gram positive bacteria are more acidic as compared to gram negative bacteria, and that is why they have strong bonds with the basic dyes what we use, that is crystal violet. Then cell wall of the gram positive bacteria is thick because of the thick peptidoglycan layer, teichoic acid is present in that, and less lipid. So because of that there is strong affinity and retaining property of the principal stain, that is crystal violet. And gram negative bacteria, they are, the teichoic acid is absent, cell wall is thin, and they are less acidic and more lipid in cell wall. So after the so there is less strong bonds of the with crystal violet, and plus after decolorization the pores are formed because of the lipid is dissolved in that acetone alcohol, and through which the stain is removed or washed, and that is why gram negative bacteria do not retain crystal violet color, and therefore they are stained by counter stain, that is safranin. So reagents used in these are mainly four: crystal violet, that is principal stain which stains bacteria violet, then gram cyanide, it is acting as mordant, and then decolorizer alcohol acetone which decolorizes the slide in gram negative bacteria, and safranin which acts as a counter stain in gram negative bacteria and gives pink color to the gram negative bacteria. So we already saw the procedure. So that is, first you have to pour crystal violet, wait for 1 minute, then wash, then pour gram iodine, then wait for 1 minute, then wash under tap water, then decolorize for few seconds with acetone alcohol, and then apply safranin with 1 minute, and then wash, and then dry, put oil, and then see under microscope oil immersion lens. So here you can see now gram positive bacteria, they are violet in color, and gram negative bacteria, they are pink in color. And if they are cocci, they are round, they are called as cocci, and if they are rods, they are called as bacilli. So few examples of gram positive bacteria, they are streptococcus, staphylococcus, pneumococcus, and in gram positive bacilli, they are corynebacteria, bacillus. Then gram negative bacilli, they are E. coli, Klebsiella, Salmonella, Proteus, Shigella, and gram negative cocci, they are Neisseria group, that is Neisseria meningitidis and Neisseria gonorrhoeae. Principle of Zn staining is the organisms like Mycobacterium tuberculosis which causes tuberculosis, and Mycobacterium leprae which causes leprosy are acid fast. So that means they are resistant to acid treatment. So that is why it is also called as Zn stain or acid fast stain. So this acid resistant to acid treatment is because of the lipid containing in the cell wall of this mycobacterium, that is mycolic acid, and because of that they are not decolorized by strong acids and alcohols after they bind with the carbolfuchsin, that is primary stain. And then because they are not decolorized, they are not stained by counter stain, they are stained by carbolfuchsin, that is pink in color. That is why in blue color background or other bacteria are blue in color, pus cells, neutrophils are blue in color, and then you can see pink color rods of the mycobacteria, either tuberculosis or leprae according to the sample. So in tuberculosis it is sputum sample, and in leprosy it is skin scraping. So procedure we already saw. First you have to heat fix the smear, make smear, heat fix, and then pour carbolfuchsin, again heat for few films you will see, and then wait for 5 minutes. So this heat gives you fixation of the smear, and then you have to wash and decolorize with the 20% H2SO4, then wash and then counter stain with counter stain with methylene blue, so that you will get blue color background, and in that if acid fast bacteria are present, they are pink in color. And Mycobacterium tuberculosis bacteria, they are seen as pink color beaded rods, either single or in groups, and they are slightly curved. So here in this picture you can see this acid fast bacteria in blue background, and in 10 cells if you count no bacteria, it is absent. 1 to 2 bacteria, then it is 1 plus. 2 to 10 bacteria, it is 2 plus. 100 to 10 to 100 bacteria, it is 3 plus, and more than 100 means many clumps if you see, it is 4 plus. So this is a reporting system. Media. So sticking on the plates is done this way. So it is first you have to take this, you have to heat the wire loop on a flame till it becomes red hot, then wait for some time so it will be cool, and then after that you have to take the sample in wire loop and then do primary inoculation. Then from that primary circle you have to draw the lines horizontal, then rotate the plate, then again draw the lines, then rotate the plate, again draw the lines. So this, and then after that tail in the end. So this is primary, secondary, tertiary and quaternary inoculation you have to do, so that you will get isolated colonies to study colony characteristics. The antibiotic sensitivity testing media is done on Muller-Hinton agar for the antibiotic sensitivity testing, and that is usually done by Kirby-Bayer disk diffusion method. Hello students, today we will see serological test. So first is RA test. So it is rheumatoid arthritis test. So clinical significance is RA test is done to detect presence of rheumatoid factor in patient of rheumatoid arthritis. So rheumatoid arthritis is a disease of the old age patients, in that all the joints are, major joints are involved. Procedure, in short, you have to take 3 circles, label it as test, positive control, negative control, add serum to test, then positive control 1 drop to PC and negative control 1 drop to NC, and then add antigen provided in the kit, mix and wait for 2 minutes, and then see for the clumps. C-reactive protein, CRP, it is also done same way. Take test, positive control, negative control, and then add serum and then reagent and mix and wait for 2 minutes and see for the clumps. So C-reactive protein significance, it is mainly a inflammatory marker of inflammatory condition of infectious or non-infectious origin. So when the WC count is raised, ESR is raised, CRP is also positive. Anti-streptolysin O titer, that is ASO test, it is done for the investigation of rheumatic fever. It is a post-streptococcal disease. In that, anti-streptolysin O titer is raised, and procedure is same as RA and CRP. You have to take 3 circles, test positive control, negative control, add serum, PCNC and add reagent, and then wait, mix and wait for 2 minutes and see for clumps. Thank you. Hello students, today we will see serological test, that is Vidal test and VDRL test. So Vidal test is done for diagnosis of the typhoid fever and paratyphoid fever, that is caused by Salmonella typhi and paratyphi A and B. So in that, what is the principle? So in that 4 antigens are there, O, H, AH and BH. So O is pink color, O is blue color, and H, AH, BH are pink color reagents. So procedure by slide method, you have to add 1 drop of serum, 1 drop of positive control, 1 drop of negative control, and then you have to add, so the total 4 drops you have to take to add 4 antigens of the serum, and then add 1 drop of O, H, AH and BH antigen, mix and then wait for 1 minute and then see for the clumps. So if clumps come within 1 minute, then it is the positive test. So O and H for the typhoid fever, AH for the paratyphoid A fever, and BH if clumps are there, then it is for paratyphoid B fever. Then VDRL test, so it is venereal disease research laboratory test, method by slide method. Again you have to take 1 drop of serum, 1 drop of positive control, 1 drop of negative control, then add antigen to each one drop, and then mix and rotate for 8 minutes on the VDRL rotator or by manually, and then see for the clumps. So here you will see floccules. So report can be done if no floccule seen, non-reactive; if weak floccule seen, weakly reactive; if strong floccule seen, it is strongly positive. And then significance, it is done for the diagnosis of the syphilis test, and syphilis is caused by Trypanoma pallidum spirochetes. It is a sexually transmitted disease, and then it should be done usually in pregnancy to rule out congenital syphilis, because in that baby may get stillbirth, IUD, or mental retardation. So that syphilis test is done. Thank you. Hello students, today we will see Montague's test. So in short, what is Montague's test? It is also called as tuberculin test. So it is done for the diagnosis of the Mycobacterium tuberculosis infection in a patient. So in that, what is the principle? So Montague's, that is PPD, protein purified derivative, is given intradermally, and then after 48 to 72 hours you have to see induration, that is swelling, and erythema, that is redness. So what are the uses of Montague's? Usually for the diagnosis of suspected infection by Mycobacterium tuberculosis, or epidemiological survey of the tuberculosis, or post-vaccine checkup of the BCG vaccination, or in cattle also we can do for the diagnosis of the tuberculosis. So procedure in short, you have to take left forearm, clean it with 70 to 80% alcohol, then make a round with the pen in that area where you will give prick. So with help of 0.1 ml PPD into the tuberculin syringe or Montague syringe, that is 4 lines in that you have to take, and then inject superficial layer of the skin, that is intradermal, and then after injection you will find swelling, that is bleb over the skin prick, and then that means your injection is intradermal, and then ask the patient to come after 48 to 72 hours. So in result or interpretation, if induration, that is swelling, is more than 10 millimeter, then it is positive. If it is less than 5 millimeter, it is negative, and in between 5 to 9 millimeter, it is doubtful. So you have to repeat the test. Thank you.
Newer techniques. The first one is the ELISA, enzyme link immunosorbent assay. So principal antigen antibody complex attached with the enzyme plus substrate activates chromosomes, and then color changes there, and that is detected by ELISA reader. Enzyme is the peroxidase, immunosorbent is a polystyrene or polyvinyl material, substrate is the hydrogen peroxide. Types of ELISA: direct ELISA to detect antigen, indirect ELISA to detect antibody, sandwich ELISA to detect antigen, competitive ELISA to detect antigen. Application: sensitive test to detect antigen antibody reaction for HIV, hepatitis A antigen, hepatitis B, E antigen, HCV, NS1, dengue antigen, Epstein-Barr virus antigen, HSV, toxoplasma. Advantages: test is specific, sensitive, large number of samples tested at one, mostly used in the blood for the screening of the donors. Disadvantages: costly. Enzyme linked fluorescence assay, modification of ELISA. So it is automated system, and antigen antibody complex is detected by fluorometric system. Application: markers of hepatitis viruses, HIV, antibody to torch, measles, mumps, rotavirus, and H. pylori. Immunofluorescence assay. Fluorescence refers to absorbing high energy short wavelength ultraviolet light rays by the fluorescent compounds, and in turn emitting visible light rays with low energy, longer wavelength. Fluorescent dye is used to conjugate the antibody, and such labeled antibody can be used to detect the antigen or antigen antibody complex on the cell surface. Types: direct, indirect flow cytometry. Flow cytometry is laser-based technology that quantitatively analyzes and separates the cells as they pass through the laser beam. Application: detection of autoantibodies, antinuclear antibody in autoimmune diseases, detecting microbial antigen, the example rabies antigen in corneal smear, then detection of viral antigen in cell line inoculated with the specimen. Flow cytometry, CD4 count in the HIV infected patient, detection of leukocyte with specific marker for diagnosis of various lymphomas. Mycology, study of fungi. So lab diagnosis of fungi infection. So first specimen collection like skin, nail scraping, hair, blood, or sputum, CSF, blood, pus tissue. Direct examination, so mainly 10% KOH weight mount is there. So KOH will digest the debris and keratin, and then we can see the hyaline structure of the fungal cells. Then gram staining, India ink for the capsule demonstration. Fungal culture, mainly the common media is saprots dextrose agar, and selective media like cornmeal agar, birdseed agar. And then identification of fungal culture, macroscopic by rate of growth and pigmentation, and microscopic by making slide and done LPCB wet mount. So you can see blue color colonies, and then according to the structure you can identify. And others taste like in Candida, GTT, that is germ tube test, dermatophytes hair perforation test, Cryptococcus aureus test. Laboratory methods for isolating and identifying clinically important fungi. So first, specimen collection. Second, direct demonstration of fungal elements by microscopy. Third, isolation of the fungus in culture. Four, immunological evidence of infection. Five, other tests for the diagnosis of fungal infection. Example, skin test for hypersensitivity, molecular methods. First is specimen collection. So according to the site, superficial infection, skin scraping, then hair pluck from the root, and nails clippings. Subcutaneous tissue biopsy, mycetoma granules from the infection or sinus tract, deep and opportunistic infection, blood, CSF, pus discharge, sputum, and other body fluids, and aspiration. Microscopy, second step, the potassium hydroxide preparation 10%, it digests keratin. So KOH wet mount can be done for demonstration of fungi. Second, gram staining. In that they are gram positive is cells can be seen. Example, Candida. Cauliflower white stain. Then India ink or nigrosin staining for capsule demonstration of the Cryptococcus. Methenamine silver stain and periodic acid shift stain can be seen in histopath preparation. Lactophenol cotton blue. LPCB can be seen for the demonstration of the colonies. Third step is culture, temperature ranging from 25 to 30 degrees Celsius, slow growing, and then media used taprots, dextrose agar, most common fungal culture media. It contains dextrose for nutrition to fungi and acidic pH to inhibit commensals. Second special media, selective media is bird seed agar, niger seed agar for Cryptococcus, cornmeal agar for the chromogen candida, blood agar, brain heart infusion agar. In preparation of slides, LPCP mounts, so taste mounts. In that colony can be taken on slide and then cover slip is applied, but here the morphology of the fungi get distorted. Second slide culture, so on slide the STA block is taken, and on that the growth is done, and then can be seen under microscope. Cellophane tape method, so the cellophane tape is applied on the agar block and then can be put on the slide, and then growth is seen, colony is seen. So that is cellophane tape mount. Laboratory methods for identifying fungi. So morphological identification, rate of growth at 37 degree or room temperature 25 degrees Celsius. Color and morphology of the colony and its texture. Pigmentation on the obverse, that is front, and reverse, that is backside, whether diffusible or non-diffusible. Microscopic identification. So LPCB mount is done, that is lactophenol cotton blue. So in that lactic acid, phenol, and cotton blue for the blue coloration. So in that can see hyphae that are septate or aseptate. So aseptate hyphae is in mucor, septate hyphae is in dermatophytes. Mycelium, vegetative or aerial, conidia or sporangium. Then other tests for identification of fungi, germ tube test in Candida, hair perforation test in dermatophytes, urease test, Cryptococcus, fermentation test, antifungal susceptibility test, antibody detection, antigen detection, cryptococcal antigen in CSF by latex agglutination, rapid diagnostic test, nucleic acid hybridization, polymerase chain reaction test. Lab diagnosis. So first specimen can be stool or rectal swab, then demonstration of parasitic forms by microscopy, culture, animal inoculation, xenodiagnosis, immunodiagnosis, that is skin test, serological test, molecular diagnosis, DNA or PCR, other laboratory tests to detect cytological or biochemical alterations in blood like CBC, IgE.
Now let's study indications of examination of stool. So first, it is required for the detection of parasites, infestation of intestine like hookworm, roundworm, Entabima histolytica, which causes amoebic dysentery. Then bacterial infection of intestine studied by cultural examination of stool like bacillary dysentery, which caused by Shigella, enteric fever, cholera. Then chemical examination of stool is done to detect defect in absorption, that is malabsorption syndrome. Urobilinogen estimation to study excessive hemolysis. Occult blood test is done for detection of ulcerative lesions of upper gastrointestinal tract. For lab diagnosis of parasitic infection, the specimen is stool and it is done for detection of ova, cysts, tropozoites, eggs, larvae of the parasites. So collection of sample is done by either direct stool examination, or other samples can be NIH swab, that is National Institute of Health, is used to collect samples from the perianal area in the infection of enterobius infection. Then cellophane tape is applied to the perianal area of the patient early in the morning. Or string test for duodenal samples for tropozoites of Giardia lamblia. So these are different methods of the sample collection of the stool. Then after that, stool preservation can be done in polyvinyl alcohol, merthiolate iodine, Shodin fixative, or formalin solution. So this is a stool container. In that plastic container, sterile container, with the spoon attached to the lid of the container. Now when to examine the stool sample? So if consistency is liquid stool, then you have to examine it within 30 minutes, because in that we are examining tropozoites, that is motility of the parasites. So tropozoites like amoeba or giardia. Then semi-solid stool we can examine within 1 hour, and solid stools of formed stools up to 24 hours after collection, because in that we see mainly cyst forms. In semi-solid we can see both tropozoite and cyst form. The first step is macroscopic examination of stool. So consistency of stool, like it is liquid, semi-solid or solid. Then blood or mucus present or absent. Then few parts of the intestinal parasites like adult segments like Ascaris, Enterobius vermicularis, tapeworm. So we can see that parts of the parasites. In microscopic examination of stool, first step is the routine examination, that is by saline wet mount and iodine wet mount. So in saline mount, procedure is take 1 drop of normal saline on slide, mix stool sample, put cover slip and see under microscope. The advantages of saline mount: useful in detection of tropozoite cyst of protozoa, eggs and larvae of helminths. Motility of tropozoites and larvae can be appreciated. Bile staining property, that is they appear golden brown, and non-bile stain eggs appear colorless. So non-bile stain eggs examples are hookworm, enterobius and H. nana, HEN. Then iodine mount, the procedure: take 1 drop of Lugon's iodine on slide, mix stool sample, put cover slip and see under microscope. Advantages: the nuclear details of the protozoan cyst, helminth eggs and larvae are better visualized. Disadvantages: iodine immobilizes and kills the parasites, so motility of the tropozoites and helminth larvae are not appreciated, and bile staining property is not appreciated. Second method is the permanent stain smears. So it is done for detection of protozoan cyst and tropozoites by staining their internal structures. The common methods are: first is the iron hematoxylin stain or trichrome stain, and modified acid fast stain. It is useful for the coccidian parasites like Cryptosporidium and Isospora. So in that 0.5% acid, that is H2SO4, is used, and that is why it is called modified acid fast stain. And these parasites are mostly opportunistic infections in the HIV patient. When eggs or larvae or parasites are very few in number, Then concentration techniques are used. So first is sedimentation method and second is flotation method. So in sedimentation method, the parasites are recovered in the sediment using either gravity or centrifugation. So the techniques used are formalin ether or formalin acetone. So stool sample and these reagents are taken in centrifuge tube and then it is centrifuged and then deposit is taken. In that we can find the morphology of the parasites. The advantages of sedimentation method is easy and minimal technical error is there. Morphology of eggs and cysts are preserved and it is more sensitive. The flotation techniques, stool is mixed with solution having high specific gravity, and the techniques used are saturated salt solution or zinc sulfate flotation method or sugar flotation method or saturated magnesium sulfate solution techniques. The disadvantages, some helminth eggs like trematodes, tinea, unfertilized eggs of ascaris do not float in the salt solution. And then distortion of morphology of the eggs and cyst is also there. So in this stool microscopic examination, we can see different morphological forms of the parasites.
Lab diagnosis of viral infection. So indications to start antiviral drugs, screening of blood donors for HIV, hepatitis B and hepatitis C, surveillance purpose for outbreak or epidemic investigation, and to start the post-exposure prophylaxis in AIDS or hepatitis B virus infection. So first step is sample collection. So samples like blood, throat swab, nasopharyngeal swab, swab from lesions are taken. Precautions taken. Swab collected in VTM, viral transport media. pH is maintained and organism is viable. Cold chain should be maintained. Temperature 4 to 8 degrees Celsius for 24 hours. For longer duration, minus 20 degrees Celsius, freezing is done. Direct demonstration of virus. So first is electron microscopy. So we know size and shape of virus. So rabies bullet shape, rotavirus wheel shape, coronavirus penta, corona shape, papillomas, adenovirus space vehicle shape. Then immunoelectron microscopy, fluorescent microscopy, and light microscopy. So in light microscopy, demonstration of inclusion bodies, like example, rabies virus in dog is negri bodies. So inclusion body aggregates of virions or viral proteins and other products of viral replication that alter staining property of the cell. Host cell. The characteristic of special viral infections, they have distinct size, shape, location, staining properties by which they can be demonstrated in virus infected cells under the light microscope and help in diagnosis of the viral infection. So types are three: intracytoplasmic, intranuclear, and both. So intracytoplasmic, generally acidophilic and can be seen as pink structures when stained with giemsa or using methylene blue stain. Most pox viruses and negri bodies seen in rabies virus. Intranuclear are basophilic in nature. Example, Cowdery had classified them into Cowdery type A, that is seen in herpes simplex infection. Both intracytoplasmic and intranuclear inclusion gives the appearance of owl's eye appearance seen in cytomegalovirus. What is serological method? So detection of viral antigen by various formats such as ELISA, direct immunofluorescence, immunochromatography, flow through assays. That is seen in HIV. Detection of specific antibodies, your diagnostic formats such as ELISA, immunochromatography, flow through assays. Molecular methods related to viral genes, nucleic acid probe for detection of DNA or RNA by hybridization method, PCR for DNA detection by amplification, reverse transcriptase PCR for RNA detection, real-time PCR for DNA quantification, real-time RT-PCR for RNA quantification, that is viral load. Fifth step is the isolation of virus. So first animal inoculation, but because of the ethical issues, animals are not used. Second, embryonated egg inoculation. So hence embryonated eggs are used for cultivation of viruses. So parts of the eggs are chorioallantoic membrane for pox virus, allantoic cavity, influenza vaccine and yellow fever vaccine, amniotic cavity, isolation of influenza virus, and yolk sac, arboviruses, rickettsia, chlamydia. Third is tissue culture, organ culture. Organ can be used. Then explant culture, that is parts of the organ, and cell line culture. Types are primary, secondary, continuous. In continuous, malignant cells are used so that they divide continuously. Then the growth is seen by uh, cytopathic effects. So these are morphological changes produced by virus in the cell line detected by light microscope. Example, syncytium or multinucleated giant cell formation seen in measles, diffuse rounding and ballooning of cells seen in HSV, herpes simplex virus. HIV, hepatitis B, and hepatitis C. So HIV, HBV, and HCV are mainly done in donor screening or the antenatal screening. So their method is usually immunochromatography. So HBV is detected by lateral flow, and HIV and HCV is by vertical flow or tri-dot method. Let's study biochemistry practicals. So first is the lab instrument. So balances to weigh the reagents for making solution, centrifuge for separation of serum plasma and fluids, pH meter to take pH of the solution, calorimeter or photometer, Beer-Lambert's law. OD of the solution is directly proportional to color of the solution, and in colorimetric OD measurement for the RFT, LFT, tests like BSL, BUL, creatinine, and the OTBT bilirubin. Photometer, same machine, but it is mostly fully automated or the semi-automated. Flame photometer, estimation of sodium potassium chloride. So the luminous strength of the flame is measured. Ion selective electrodes, potentiometry, measures activity of ions in the solution, pH meter. Determination of blood sugar level. The method is glucose oxidase peroxidase method, GOD-POD, and then in that pink color solution is formed. So the test standard and black. Three test tubes are taken, reagents are taken, and fluoride plasma sample is added. And then after incubation, take the reading at 530 nanometer. So it is green filter, and the calculation OD of test divided by OD of standard into concentration of standard, and the concentration of standard provided in the kit is 100, so you can calculate by the 100. And then normally it is 75 to 115 milligram in fasting blood sugar level, and increase is seen in hyperglycemia, that is diabetes mellitus. Determination of blood urea level. So method is diacetyl monooxime. So that urea reacts with diacetyl monooxime and forms the pink color compound, that is thiosemicarbamazide and ferric ions to form the pink color compound, and it is measured against the green filter, that is 530 nanometer. So after taking three test tubes, reagent and plasma, then calculate the OD is taken, and then calculation OD of test divided by OD of standard into concentration of standard, that is 20. Normally it is 7 to 23 milligram, and if it is increased, it is increase in the renal condition, that is disease of the kidneys like glomerulonephritis, pyelonephritis, or the renal failure. Determination of serum creatinine by alkaline picrate method. So in that, creatinine reacts with the picric acid in alkaline medium to form the reddish yellow complex, and then intensity is measured against the 520 nanometer filter. Calculation OD of test divided by OD of standard into concentration of standard, that is 1. Normally it is 0.7 to 1.7 milligram per deciliter, and it is increase in renal failure. And determination of the uric acid in the serum. So the uric acid in the protein-free filtrate reacts with the phosphotungstic acid reagent in presence of sodium carbonate to form blue color complex. So in alkaline solution, or you can take another methods, and then intensity of that reaction you have to measure, and then formula is OD of test divided by OD of standard into concentration of the standard, that is 6. So normally it is up to 6 milligram percent, and clinically increased in the gout and other conditions like renal failure, uremia, and leukemia. Determination of calcium in serum. So calcium reacts directly with the chrysophthalin complex and forms the color, and then that color is taken OD. So three test tubes taken, test blank and standard, and reagent is added. Then sample is added, given according to the kit insert, and then after incubation, particle density is taken. Formula OD of test divided by OD of standard into concentration of standard, that is 10. Normally calcium 8.5 to 10.2, decreased calcium seen in hyperthyroidism, rickets, osteomalacia, and then increased calcium seen in hyperparathyroidism, hypervitaminosis D, and multiple myeloma. Determination of serum proteins method, Biuret method. Principal: proteins react with cupric ions in alkaline medium, form violet complex, and intensity of the color is taken against the 530 nanometer. Then 3 test tubes are taken, test blood standard, and then the reagent added, serum added, standard added, and then incubation done, and then OD of the test is taken for each test tube. Serum proteins total is equal to OD of test divided by OD of standard into concentration of standard, that is 6. Normally, the serum proteins are 6 to 8 gram percent. Clinically, increased serum proteins seen in dehydration, myeloma, chronic inflammation, decreased proteins, overhydration, renal disease, hepatic disease, malnutrition, and malignancy. Determination of serum albumin. So method is bromoglycine green method, BCG method. Albumin present in serum binds specifically with bromoglycine green at pH 4.1 to form green color complex, and intensity is measured colorimetrically by using 640 nanometer, that is red filter. And the 3 test tubes are taken, test, blank, and standard. Reagents are added, then sample and standard are added, okay, quantity given according to the kit insert, and then OD of each test tube is taken, and the formula OD of test divided by OD of standard into concentration of the standard, that is 4 milligram per cell. So serum albumin is measured, and serum globulin is calculated by formula, that is total protein minus albumin, and AG ratio, that is albumin and globulin, the ratio is taken by serum albumin divided by serum globulin. The normal range of albumin is 3.3 to 4.8 milligram per cell, and globulin is 1.8 to 3.6 gram per deciliter. Normal range of AG ratio is 1.2 to 1. And, clinically, albumin is decreased in renal disease, liver insufficiency, severe malnutrition, pregnancy, and burn. Increased albumin is seen in dehydration. Increased globulin seen in the infection. Determination of serum cholesterol. So method is calorimetric, that is Watson method. So cholesterol reacts with acetic anhydride in presence of glacial acetic acid and concentrated sulfuric acid to form green color complex, and intensity is measured against the 570 filter. The sample is serum, that is fasting sample, and then you have to take 3 test tubes, test, blank, and standard, add reagent, then add sample and standard given in the kit. The standard's concentration is 200 milligram percent, and then after incubation take the OD, and according to the formula the result is there. So formula is OD of test divided by OD of standard into concentration of standard, that is 200. So normal range of cholesterol is 150 to 250 milligram per deciliter, and it is elevated in the atherosclerosis, nephrosis, diabetes mellitus, obstructive jaundice, mixed edema, that is hypothyroidism, and decreased levels is seen in hyperthyroidism, malabsorption, and anemia. Determination of serum bilirubin. So method is DMSO, that is dimethyl sulfoxide method. So in that, first we have to do total bilirubin estimation, then direct bilirubin estimation, and then indirect bilirubin is calculated. Total minus direct is equal to indirect. So normal range total bilirubin is 0.1 to 1.2 milligram percent. Direct bilirubin is 0 to 0.3 milligram percent. Indirect bilirubin is 0.2 to 0.8 milligram percent. And increased bilirubin level is seen in hyperbilirubinemia, that is jaundice. So jaundice are of 3 types: pre-hepatic, hepatic, and post-hepatic. So total bilirubin is raised in the in all types of jaundice, but direct bilirubin is raised only in hepatic and obstructive, that is post-hepatic jaundice. Indirect bilirubin is markedly raised in pre-hepatic, that is hemolytic jaundice. Determination of SGPT, that is serum glutamate pyruvate transaminase. So there is reaction, alanine plus alpha ketogluteric acid forms pyruvic acid plus glutamic acid, and that pyruvic acid combines with the dye and gives the color, and it is measured enzymatically. Normal range is 7 to 56 international units, and increase HBT seen in viral hepatitis, toxic hepatitis, alcoholic hepatitis. Increase is seen in end-stage liver disease. Determination of HOT. So it is serum glutamate oxaloacetate transaminase. The principal aspartic acid plus alpha ketoglutaric acid forms oxaloacetic acid plus glutamic acid, and that oxaloacetic acid reacts with the dye, and then high color is formed, and it is in alkaline medium. The OD is measured. So it is enzymatic reaction. Normally it is 5 to 40 international units, and clinically increased HUT seen in hepatocellular destruction, either viral or toxic, myocardial infarction, musculoskeletal disease, and decreased HUT seen in end-stage liver disease. Determination of alkaline phosphatase. So it is method P-nitrophenyl phosphatase, PNP. So paranitrophenyl is colorless. The enzyme splits of the phosphate group from it to form P-nitrophenol, which is acid form, and in dilute solution it is colorless. Under alkaline condition it is converted to p-nitrophenoxide ions which exhibit yellow color, and the OD is measured. The normal range in adults is 20 to 90. In children, it is 93 to 221 international units. And there are three types of phosphatases: alkaline phosphatase, acid phosphatase, and red cell phosphatase. So alkaline phosphatase elevated in hepatobiliary disease, bone disease, with increased osteoblastic activity.
Hope you find this session useful for your understanding and for your exams. Thank you.